Okay.
Yeah,
Did you
we're
find
there. We're,
did you
we're
find did you find out what happened? Was it a setting?
it was my Facebook Live. Yeah, there we go. Okay, now we're good. Now we're good.
Your Facebook
Yeah,
live said,
in the Facebook Live in the studio,
mm-hmm.
for some reason the thing was set to only me.
Oh,
So only I could see myself on Facebook Live.
okay.
That's
Yeah.
like, why would you want to do that? But anyway,
Aloha gang.
aloha everybody. Let's see if well, now we know it's on. So here we go. Now I see him. Now I see him. Now I see him.
Yeah, people coming on.
Okay, good.
Yeah.
There we go.
No, you
Okay.
do. I was having withdrawals.
Oh gosh. Aloha everybody. Aloha Friday to each and every single one of you. Sorry for the delay. We had a little technical issue again with Facebook, but like everybody, OMG, I wonder where you guys was. We
You
was freaking out ourselves. We were freaking out ourselves because, and that's why we come on early. That's why we came on early. We came on at 6:45, like we always do,
and by the
and it wouldn't work. But we figured it out, and we are now live. So, and I see a lot of you jumping on. So, thank you all. Thank you for hanging in there.
yeah.
Appreciate you guys. Anyway, how's your day, Charles? How was your day?
Well, I had a very nice time with the gang from the Grand Pacific Resorts, the Makai Club, and the Hanalei Bay Resorts. I did their CPR training today, but we did it in a safe manner. We did it online, Zoom, and was very good. Very good. It's a little different, but uh, there's some nuances to it. But you just have to be articulate when you ask certain questions, and but for the most part, good group of people. So I like to say aloha, mahalo, and if I may, if you folks have a chance, just share this. Okay, just share this. But if right here, a good brother, good friend. This is Mr. Randy Oligo. Today was his celebration of life. He passed away on November 6, 2020. For those of us here on the island of Kauai, we know Randy. He's a 77 grad from Waimea, I believe, and was sad. But we know we're gonna meet up one day, so I want to extend my heartfelt condolences to his family, to his beautiful wife, Francine, children, Clifton and Randy Lee. Okay, better known as Kaliko and Noi, and to his grandchildren and to his siblings, Tino, Felicia, and Fred. And God, only God has his plans, and he knows our time here on earth. So I pray that you know, pray that the good Lord be with all of you and help you through these times, because that's what it'll take, right? It'll take time for healing, like anything else. And gonna miss that guy, but he worked for me for some years at Kukui Ula Security. So good brother, and he had a big heart because he was working at for years at over at Syngenta. So whenever we had fundraisers, he and his brother Fred would be the ones to bring over the light towers, light up the place, especially when we had fundraisers at parks and whatnot. Over at the Waimea cottages, he was always the one bringing over the lights. So I just wanted to extend my heartfelt condolences to the family. Thank you, brother. Thank you.
Well, thank you for that, Charlie. I mean, gosh, I actually still in shock when I mean, you told me this a few days ago. I had not heard, and I know Randy so well. I know his wife so well.
Hmm.
Good people, community people.
Yeah.
That's a huge loss, huge loss. So prayers and condolences. Also, Kalani Teles lost
Yes.
his battle today as well. Young man, young family.
Mm.
That one hurts too, man. I mean, guys, life is short, and we gotta learn to appreciate each other in our lives. And it always, when it hits home, and it's somebody you know, and when somebody you love, and it's somebody you care for.
Mhm.
Just sad, it's sad, and these people, it's we don't know why. I remember once I was going through some rough times, and I was talking to my pastor, and he said, Mel, it's not for us to ask why. It's for us to ask, uh, now what do we do? What do we do going forward? We don't know why, but yeah, it's sad, and prayers, condolences go out to all of those that have lost their lives and families that are struggling right now.
Yes.
Man, it's never a good thing, never a easy thing, never. It takes a while, but prayers go out to all of them.
Mhm.
And as you can see, it's just Charlie and me tonight. We're you know, I I don't even know where to start. Let me just start with some numbers, because I think if you watch the news today, Charlie, I mean, we spoke for a very short time today, but today across the country, over 153,000 new cases today across the country, the
Yes.
highest it's ever been in this pandemic, the highest it's ever been, and it's growing every day. Every state in the last week, every state, 50 states reported increases in infections. The Midwest, California, Texas, the hardest hit right now. And the predictions right now is that by the beginning of December, we are going to, the COVID deaths will surpass the 300,000 mark. So I hate to start the show off with oh, Laurel just corrected me. It's 194,000 new cases in 24 hours. Yeah, the number keeps rising. Thank you for that, Laurel. And we are, all of the states right now. I spoke to my daughter this morning. She called me up. She was working. She couldn't listen to the Oregon governor's press conference. She asked me to listen to it for her and then let her know what was said. And the Oregon governor was very clear this morning. She said that they're in a 2-week, she calls it a freeze. Everyone else calls it a lockdown. She calls it a freeze.
Mhm.
Basically, stay-at-home order. She put in some travel restrictions. Everybody that comes into Oregon got a self-quarantine for 14 days. They don't have a testing option. It's everybody that comes into Oregon will quarantine for 14 days. And it's all of the states now are reviewing their lockdown policies. What's interesting is, Biden, and again, this ain't political. I'm just stating the facts that, President-elect Biden put together a scientific advisory committee, which I was very happy to see. And they were discussing the possibility of having a nationwide lockdown, but that was dismissed. They're not recommending that. But each state today is revisiting their lockdown policies because they know it's coming, people. The amount of cases throughout the United States right now, it's at a point that is extremely frightening. You heard the mayor last night, Charlie, and yeah, I gotta say, this guy is an honest dude, man. And he just comes on last night, and I know Derek for a very long time. I tell people we were friends before we were politicians. We're still friends. But if you know Derek, you could sense the sincere concern and the fear he has. He called it concern last night. That it is probably at the highest point. This concern that he has for this island right now is at the highest point it's ever been in his life, and I respect him for that, because it is for me as well. I'm afraid of what is to come. You heard Dr. Behrman last night clearly say, and I'll never forget this, Charlie. When people say things, sometimes it sticks with you forever. This one will. When she said, when you ease up travel restrictions at the same time that the virus is increasing in numbers, it's a recipe for disaster. That's what she said. She said it on the news as well. She said the same thing. I was so happy, Charlie, because after we had Paul's show, I watched the night news. They had done an earlier recording with her from yesterday. I knew it was yesterday because she had the same clothes, same background, everything was cool. But I was so honored that this woman that's on the news was on our show. She said the same thing. Recipe for disaster. So our mayor, our district health officer, governors from across the country are all on the same page that, hey, well, I shouldn't say governors from all across the country, from 49 states are saying we got to review our lockdown policies. We got to be careful because this thing is out of control, and it is. So I didn't want to start off with that kind of somber news, but that's what it is. And people, we as individuals, again, and I hate repeating myself, but we gonna have to take it upon ourselves. Charlie spoke today. I don't know if you're at liberty to talk about it, Charlie, about Maui. We talked a lot last night about reporting. We talked a lot about how Kauai does it, how Kauai counts all the positive cases, whether they tested positive or the test was done in the mainland or here. If the state wants to count the positive case in the state that they took the test, fine. On Kauai, our administration has taken it one step further and said, we're going to count all of the active cases here on Kauai. And I'm thankful for that. I don't believe that is happening on the other islands. And Charlie, I'll turn it over to you so you can explain a little bit. But we know for a fact that people are here in this state positive, and those numbers aren't being released. Not on Kauai, but on the other islands, those numbers aren't being released to the people. That is troubling. That is troubling, Charlie.
Well, I mean, let's take a step back, and I say this with all sincerity that there is no use getting angry anymore. It's not going to get us anywhere. I told my wife tonight while I was watching a newscast. There was this news reporter on one of the syndicated national news agencies, and she was so excited and she talked so fast that you couldn't understand a damn word she was saying. And so it's so when we're trying to explain something to all the viewers and we speak, sometimes we get so angry that they're locked in on our anger and they're not locked in on the words that we're trying to express because we're angry. So I'm going to try to take this very, very methodically and just try to lay it out on the line here. Last night, Dr. Berman said something that was very important, and that was, it's very easy for Kauai to count because our number had plateaued pretty much close to zero. So when anything happens above that, it's very easy to spot. And I've said this, and we've said this, you and I both have said this, it's very hard to contain something when you have additional problems coming into the mix. That was always going to be a problem, right? So that's why we try to slow things down. The Trans-Pacific travelers put up that barrier. Yeah, they're going to come in, but make them work their way in so at least you can slow the pace down, because we knew that there were going to be infections coming into Kauai. Now, when I say Kauai, I really going to be speaking for the entire state, because this is happening throughout the state. So what happened was, when we started to look at the 12, 13 cases, a good friend of ours, Tyson Moises, was kind of baffled that, gee, only Kauai? And that's the same thing I said. I said, no, something else got to be happening here. It can't be just Kauai. And so, like we said in the very beginning, if you want to be one of the lowest state, one of the states with the lowest infectious rates in the nation, all you do is, you don't have to test as much. you achieve it that way, or you cook the books, and that's the other way you can achieve it, right? So I got a report today that I decided to follow up on because it was pressing, and that involves a Kahului airport. Now, for those of you on Maui, correct me if I'm wrong, but the information I got from several workers at the airport state that there are four trailers located by the rent-a-cars that's part of the horseshoe, the old rent-a-car where in the back they used to pick up the traveler and then they'll take it to a remote site where they're located, whether it's Budget, whether it's Alamo, one of the rent-a-car sites. They take it away from the airport. Well, apparently they set up fencing there and they have four trailers. These trailers have been designated as quarantine trailers for those travelers coming in who are positive. Now, what I just discovered today by talking to several different sources, okay, several, and I'm not making this stuff up. I'm just getting it from them, okay. So until I get some hard copies, I have to err on the side of caution. But yet I can see why there are not certain numbers that's coming out from there. That is, we talked about it last night, where travelers are taking the tests, the pre-tests, but not having the results on them until such time they land in Hawaii. These travelers are actually getting results upon landing that are positive. So what Maui has done, and I don't know if this is a practice or is this out of sheer frustration, but they come down, okay? They check in, they say they get on positive. If there's room in the trailers, they quarantine in those trailers because they can't get on a flight because they're going to be under quarantine. They can't get on a flight because they're positive. We found out that there's no rooms in those trailers. Okay? They're like RV trailers. So they are told, okay, you need to quarantine. Actually, the proper term should be they need to isolate because they're already confirmed positive. So you go from a quarantine situation to a positive situation, an isolation situation. And they let go from there. They just let go. Okay. Now my understanding is sometimes the DOH, they don't even come to the airport. So they leave it up to security. They leave it up to the travel industry. They leave it up to airport personnel to go babysit these folks. So my question is, who is actually contact tracing now where these people were sitting in the airplane and if they infected anybody else? Because I'm pretty sure there's other travelers that did get a positive result on their phone. I mean, they did get the test results that are negative, but have been in contact with these people. At the end of my conversation, I said, hey, how many times have this been happening? They said, well, put it this way. In this last week, they're looking at over between 15 and 18 individuals. I mean, that was positive? He goes, yeah. And what, they all came in on one flight? You go, no, different flights all over, but nobody tracking them. I say, you kidding me, right? No. So now I can see why nobody's reporting it. Okay, not like Kauai. Kauai reporting it, up there's not reporting it. Now someone said, and I went to go check, and sure enough, someone was terminated because they wrote in Facebook what was happening. That person was terminated, but then was rehired 2 days after. He was told to come back to work. What's going on? So if that's happening on Maui and they're allowing positive infected individuals to roam free, they're not isolating. I don't think they even have a chance to even go through enforcement. What makes you or I think that they're able to contain a virus on that island? What makes us think that it's being contained right now? Now that's just information that I got. And I'm gonna keep on it and I'm gonna keep on drilling this story until we get down to the bottom of it. I heard, and I hope someone from the DOH can tell me. I heard that the infamous Dr. Lauren Pang was banned from the airport. He can't go down to the airport. Something had happened, and I mean that's just what I heard. So I just passed the information on because he's a health officer for the island. I'm pretty sure he does a good job, but if you get banned from the airport, then something's not right. And I'm hoping somebody will tell me. I mean, if I'm wrong, but the information I got was not only from one source, multiple sources that works down there. So that's what happened, brother Mel. That's how my day was filled.
Yeah, I did get a private message, whatever you call a messenger from someone. They did. They said basically the same thing about Maui. I have been scrolling through the comments. I see someone saying that you are correct. So I'm assuming that person is from Maui. I don't know what to tell you. I don't know why again, why we don't have a standardized. Dr. Behrman said last night that when someone arrives, um, and they find out that they're positive after they arrive, that the Department of Health notifies the CDC, and the CDC contacts the airlines, and they do their contact tracing that way. But what it sounds like here is that the Department of Health, it may not even be at the airport, and that they're leaving it up to the security, and that is quite disturbing. That is quite disturbing. Um, Anne Marie said last night, Josh Green said on PBS Insights that there have been no sick visitors. All 18 are asymptomatic. Um, Maybe we got to buy a subscription to the Garden Island to for Josh Green. We know for a fact, we know for a fact on Kauai that visitors have gotten sick and was in the hospital. So, again, I'm not here to pick fights with anybody. I'm not here to put down anybody. What I'm here to is let you folks know, try to give you guys information, the most factual information that we have.
To ensure safety. To ensure
Unless,
yeah.
yeah, unless our our county reported false information. Why would they do that? Um, this is disastrous. Yeah. Hey, feel free to put your comments. It's just Charlie and me tonight, so we would like to share in the discussion with you folks. I wish I could bring all of you guys on the screen, but I just kind of reading the comments. As you can see, I'm trying to bring the tension level down right now after listening to Charlie. Um, and the green light really, really helps. Also want to say that Sue Kanoho, we talk about Sue a lot in a positive way, because I know early on she was getting a lot of negative uh, comments, like, not even people not even knowing what Sue does for this county. So unfair, some of the comments felt that she was, you know, part of the conspiracy to bring visitors to Kauai during a pandemic, and that is so far from the truth. Sue Kanoho from day one has been a fighter for the people of Kauai. Trust me, and Charlie can attest to that. We both know this as fact, and we know that Sue has been fighting tirelessly. And I know this because I hear not from Sue, but from those that are involved in the discussions with Sue. So I just wanted to get that out of the way. But anyway, she just texted me a article that came out today, and this is about the West Coast, because I touched a little bit about the travel advisory and so forth, but she just wanted to send this over, and she did. The three states, Oregon, California, Washington, on Friday today issued travel advisories due to an increasing number. Governors from these three states are urging against non-essential out-of-state travel, and they're asking people who do choose to travel to self-quarantine for 14 days after arriving in another state or country. That says a lot when a governor urges non-essential, discourages non-essential travel. Because that I heard that press conference today from Governor Davis, I think her name is, if I'm not mistaken. But anyway, that's a governor. She was solid, man. I don't know much about her. Today was the first time I heard a press conference from her because my daughter asked me to listen. But she was so professional. She laid out the facts. She didn't minimize anything. Neither did she scare anybody. She just put the numbers out there and said, we do not have the capacity to maintain this trend. She said, neither do our neighboring states. So we do not have the ability to borrow healthcare workers or hospital beds from neighboring states because everyone is going through the same crisis. That's powerful. See, she's concerned about her state, and she's saying because everywhere else around us, which traditionally maybe we could tap resources from, that's not available right now. So we need to ask you all to quarantine and not travel. Now, on the other side of that, across the pond, you have a governor in Hawaii who is saying the opposite. Travel, come, enjoy. Of course, local residents, if you don't need travel, don't, but the visitors come. We want you. We're open. We never did have a neighboring state where we could share hospital beds and personnel. We never had that because we're surrounded by water. But that never stopped our state. You see, we keep on going. We keep on inviting. I posted the other day about the new flights coming in, and every airline is boosting up their schedules because the demand is there. See, they're not going to increase flights if the demand is low. The demand is there. More so now because people are going to want to get the heck out of these hot zones, and they're going to be coming here. And we have not raised the red flag. We, meaning the state administration, has not raised the red flag except to the locals. They have not sent out any advisories about don't come to Hawaii if it's not essential. No, not even close. While all these other states are saying, hey, don't travel if you don't have to, we're saying, no, man, we're open. Hey, como mai. Take a test, one test, just one test. And we're seeing it on Kauai. We're seeing it. And we know that what's happening on Kauai is happening on Oahu, on Maui, Molokai, Lanai, the Big Island. We know that. It's just we're not no different. So, I sit here and I try to remain calm and then I listen to throughout the day, Charlie, and I know you get this too. You get either the phone calls, the text messages, or the messengers, or the emails that from our kupuna who is scared to death. They are so afraid. We get, I got a message today. It was kind of, woman in the army in South Korea from Kauai. She's serving her country. Hasn't been home for Christmas for 2 years. And she had the consideration. She messaged me. She says, Uncle Mel, I really want to come home, but I want to know if it's safe. I don't want to put my family at risk. See how they think. Yeah, different. Yeah. They want to make sure that it's going to be safe. They're so concerned about grandma, grandpa, and auntie, uncle, everybody. And I don't get it. I don't understand why. Why is it so difficult? I understand the economy. I understand the visitor industry. I understand all that stuff. But why can't we see the importance of keeping our island safe? I don't get it. I don't get it. Yeah, it bugs me because now is the time. You see, now is the time. We're actually late, but it's better late than never. But now is the time to raise that red flag and say, hey, it's blowing up around the country. All the other places, all the other countries are saying, they're not even accepting, a lot of countries not even accepting visitors from Hawaii or from the United States, I should say, all the United States. But not us. See, we just so off base, Charlie. We're so off base.
No, it's just, for your viewers, what you're getting is two guys sharing what they found out And I like to err on the side of trying to reason why certain things are happening. Let's take for instance this, not to change the subject. Today we get a report: 130 Secret Service agents all contracted the virus. It was also said that all 130 were wearing masks. So you know what that tells you? The same thing we talked about last night. There's another dimension to this infection, and that is the protocol of sanitizing before you taking off the mask and putting on the mask. Okay? Because there had to be that moment in time that their hands were infected, that they touched something, they touched their face, and they got infected that way. Okay? So what do we do? What do we do now? What do we do as our community? Right now the governor is not stopping or making a plea to stop travel. We know that, and he's going to use excuse that he can. Okay, but what do we do right now? We have some. We are fortunate here on Kauai that we've got a good health officer. We've got a good team that's going to report everything. There's many of you out there, real akamai. You guys catching on just by watching the comments. The comments now and 8 months ago is 180-degree flip. So that tells me that you folks been paying attention, and I'm so happy because you know right from wrong. You know what to do. Dr. Berman said something else that was very important, and that is the difficulty of really trying to find out where the spread is, because if not, it's going to revert back to community spread. We all know that the spread, the virus came here from a traveler. But remember back then when there's the problem with Dr. Park, Dr. Anderson, contact tracing, um, it wasn't aggressive enough. If we have no other recourse right now, I can only hope and pray if there's someone from the Department of Health listening, please do not allow the contact tracing program to falter. That's the only that's the only standing chance we have in fighting this thing, because you gotta know where it's coming from. Because it's almost like playing chase master or hide and go seek by yourself, right? You count to 20, you're against a tree, you come out, you look for everybody. Where they went? They didn't jump in a car with dad and they went to the drive-in. They left you home by yourself. That's why they had you out first and go against a tree and go count. They never like you around. That's what's going to happen. If you don't know where this virus is at, it's everything else will be futile. Nothing will work. So as Mel said, we get 194,000 cases today. The thing I worry about, I see some comments, not from tonight's show, but from other shows. Oh, medical hospital. Yeah, easy. But guess what, gang? You get one bed, you need about 4 to 5 personnel for that one bed. Do we have personnel on island? Some were brought in, but most of them already were taken up. In the mainland, they can't even stock people fast enough. And now, what's even more troubling, the nursing staff now has to go on quarantine themselves because they contracted the virus. Not only one, it's dangerous. Two, you lessen the workforce. So now you've got just that much more bodies not present providing service. Three, what's even worse, if COVID is dominating the hospital beds on the continental United States, guess what happened to those people who get strokes, who get heart attacks, who get into car accidents, okay, who gets assaulted, who gets slip and fall, all of those that require hospitalization, what happened to them? Are they just put in a waiting room and wait for a bed to open up because COVID has taken precedence? That's why they've always said we need to keep COVID down so there's a balance should anyone need hospitalization services, hospital services. But if COVID is going to dominate, there is no way. There is no way. I mean, if my dad was alive today and knowing what he went through and COVID was here, I probably would blow a gasket and start one fight with somebody in the hospital just so I could get my father into the hospital. But it's not possible anymore. It is not possible, gang.
You bring up a good point. A lot of the hospitals now throughout the country are canceling um, elective surgeries.
Mhm.
When I first heard elective surgeries, I thought I thought of breast augmentations, uh, liposuction, or gastric. The elective where I want to do something to my body. But no, man, elective surgery includes gallbladder, includes all of these other surgeries that are non life threatening that can wait. They're putting them off, and there's a lot of people suffering because they cannot get the care that they would normally have gotten because of this COVID. And so it's not just COVID, Charlie. You hit it right on the head, man. It's not just the COVID. It's everything medically related. It's everything, any kind of illness. I know of people that would normally be put in the hospital for observation, especially the kupuna. I remember my mom. I mean, my mom was sick, and I remember taking her in, and they would just keep her in overnight just to make sure, and it made the family feel a lot more comfortable. And that's not happening now. People are being sent home because they don't want to take up the bed. They need to keep the beds open. And can you imagine and I'm sure we'll be there, but in the we went through this not long ago when the beds in Oahu were filling up. In fact, they
Yep.
were at capacity.
Mhm.
That's not a good place to be. And we went through that. See, that was the exercise. So it drives me nuts. That was the exercise for us to make sure we were ready when the next wave and the next wave came. And yeah, so we went through that exercise. And I got to tell you something. I know our frontline workers, our nurses, our doctors, our staffers, everybody works in the hospitals, the doctors' offices. Hats off to them. Hats off to them
Yep.
because they deal with this every day. They deal with the stresses every day. They deal with the seeing these people that are sick and alone and all of that. And they have to go do this every day and then go home and try to live some kind of normal life with their families. It's like how it was when we were cops. You had a rough day, you had a crappy day, you saw somebody die, you saw something that no one should ever see, and then you got to go home and pretend like it never happened. And these nurses got to do it again and
Mhm.
again. And man, I feel for them. I feel for them, and it's not their fault. And this is the part that really upsets me is that we have decision makers, we have leaders that's supposed to be making decisions for everyone, not just the visitors, but for all of us, all of our medical first responders, cops and firefighters. And it seems like that's not even in the equation, the discussion. When they get around that core table, they're not talking about that. They're talking about how can we make it easier and more convenient for the visitor? How can we make it more convenient for the visitor industry? And that to me is criminal. I'll be honest, man, it's criminal.
Yep.
And as I watch the news from around the country and I see these states that are these guys are there's not there much more they can do except bring in the refrigerated containers for body. I mean, there's not much more they can do, and they're begging the people now. Please, you guys stay home. And humans in America, hot head, hot head. I see people today, still today. Today I was on the road a lot, and I see people all over the damn place, locals and visitors, not wearing the masks, not social distancing. So I don't know what it's going to take. What is it going to take? Is it going to take 1,000 deaths in Hawaii before people say, ooh, ooh? But see, it starts with the message, right, Charlie? As you always say, the message from our governor. There was an article today that the Senate president said they weren't going to entertain the mandatory mask mandate at the legislature. Now, I know a lot of you guys are going to probably blow a gasket, but I'm going to tell you something. I agree with the Senate president. I agree with the Senate president that mask mandate should not be a law in the legislature for one reason. If you make a law If the legislature goes in and does a special session and creates a mandatory masking law, when this COVID passes, the law is still on the books. It'll still be illegal to wear a mask. The governor right now has the ability and the authority in his emergency proclamations to make it happen right now. And that's what Senator Kochi said. He said, hey, Governor and Attorney General, you guys can do it right now. Just have the governor clarify it. This is the law for the state. This is the new rule, and authorize the counties to enforce it. That's all that needs to be. It can be done in 10 minutes. I thought it was going to be done today because he usually comes out with new proclamations on Fridays. I was hoping he would listen to the Senate president, and it wasn't done. The governor has that ability. The good thing about that is when that mandatory mask mandate is no longer needed, they don't have to call a special legislative session and bring back all the legislators to repeal a law. No, the governor can just amend the proclamation and end it. That is why I agree with the Senate president and the House Speaker. That is not what you call a special session for, not when you already have the mechanism in place in the governor's proclamation, the emergency proclamation. The governor could do it right now. He could do it tomorrow. It doesn't say it has to be Monday through Friday, 7:45 to 4:30. The governor could have his staffer write up the proclamation, add in that there is a mandatory mask mandate throughout the state of Hawaii, and I hereby authorize the counties to enforce it. Done. Pow. No more legislature, no more wasting money at the legislative special session. That is how it should be done. So I understand people got all pissed off about that. But listen, there's a time and the reason why we give the Constitution gives the governor those powers during an emergency declaration is because you don't have to reconvene. He has that authority right now. And Lieutenant Governor Josh Green says, "Oh, but they need to make it a they need to make it a fine. They need to make it $100 fine or 200, and not a misdemeanor." The governor can make it whatever he wants in the proclamation. He does not want to do it. The governor simply doesn't want to do it. So that is what needs to be done, really. So I gotta say, I just support the Senate president. I support the House Speaker with their decision to not do it that way. It's a leader. Sometimes you got to make the call. Sometimes the governor got to make the call and not punt to the legislature or punt to the feds or punt. No, grow up here, make the decision, make it happen. But you won't see that here. You will not see that in this state. You won't. Anyway, whew. Let me just focus on your green light, Charlie. Let me just focus on your green light. If you guys like us talk about anything else, let us know in the comments because we're winging it tonight. We actually just wanted to show up and talk a little bit. Yeah, new shirt, grow up here. Grow up here. I like that. Grow up here. Yeah, I got to think of a graphic.
I think, like I said before, everybody gotta keep within our own lanes on how we operate this, because it's very easy to get a stroke if we get angry over this thing. I've seen it happen too many times. Today I was told that there's this one pulmonologist, because COVID is it's a respiratory virus, and his pulmonologist been working around the clock, and he goes between 3 hospitals. Okay, so not only are we talking about personnel that got to work these hospitals, but we're talking about the doctors themselves. They don't have time for go see their family. Because why? Life and death is always on a clock. And once that hand starts to tick, okay, in a clockwise formation, When does those hands stop? When a person ceases to live, to breathe. So they're doing everything that they can to keep individuals alive. And that's what we're faced with right now. So, Mel talked about what the governor can do. Nobody really knows why, but we're gonna point it out so you can see, so you don't get frustrated for nothing. We explained it to you. We already told you you're not gonna do nothing. So we hope for the best, but expect the worst, because the worst is yet to come with this governor. We hope that he stays in his lane and does what he's supposed to do. It's not gonna happen. It's not gonna happen. So no use you blowing gasket. What you gotta do is get everybody together. And how do we stay safe? In today's class, I rarely don't do this, but I included COVID as part of my CPR training because it goes right in line with teaching the students about blood-borne pathogens. Because you as a student, you want to get certified in life-saving, in CPR, in AAD. You need to be equipped knowing that you need to go to the scene safely, and you got to make sure that when you go to the scene, you don't end up becoming one victim yourself. So I'm going to teach you how to go there and treat the scene as safe as possible so you don't end up being one victim. If you're going over there to render first aid to somebody and give them CPR, you don't want to be the one lying down next to them and somebody got to give CPR to you. Okay? That's why a lot of times I always say, hey guys, I heard you responding to that car accident. Commendable. But did you bother to look how the traffic wasn't controlled and cars were zipping around you folks while you was trying to pull the person out of the car? Maybe with all those extra bodies standing around, you could have called somebody to say, hey, stop the traffic until we can get the person out of the car. Because probably you would have become a victim yourself if you took one wrong step into that lane of travel, right? So it's stuff like that. It's stuff like that with COVID. We want you to be as safe as possible. But yet, I hear the frustration. Always get those people that they gotta gather. Okay, and I said last night, how much is it worth just to have one night of fun to a lifetime of pain and agony if you lose a loved one because you bring home that virus to your family and you lose your mom and dad or your family member, your grandma, grandpa? How much was it really worth it to you if that happened? I don't know if anybody thinks about that kind of stuff, right? Because everybody I've talked to, they get really shocked when I say something like that to them. And I tell them, hey, I'm not trying to rain on your parade. I just no. If you were to go out tonight to have fun, how much is it worth to you knowing that you possibly brought home the virus to your family and you lost a loved one because of that action that you did? Right? That's a whole bunch of pain, boy. I don't know. I'll be honest. I wouldn't be able to handle. I wouldn't be able to handle. But let's take a look at the things that we can do. First of all, I'd like to thank the individuals who wrote to me today to tell me about the Kahului Airport. I'd like to thank the sources on the ground giving me the information that I needed. I'd like to thank several of you that commented tonight that confirmed what I had said. So that makes me feel good that we're on the right path. Our job, as always, is to inform and educate. And if it's happening on the Big Island and you want to give us a call, shoot us a line. We'll find somebody up there to go do some groundwork for us. And then we'll report it. Because I think it's important. Because, hey, 8 months of this, there's got to be a pot of gold at the end of the rainbow. There's got to be a pot of gold, man. What is that pot of gold that we all come out of? Yeah, right there.
Here.
Yeah.
Tua Tango Vailoa rookie card with his autograph and a piece of his patch from his Alabama. That is the pot of gold at the end of this pandemic, man. I tell you. And I tell you, I'm so excited for Tua.
Yep. So what do we do? Eh? How do we get to that pot of gold? Pot of gold is, hey, we keep on doing what we gotta do, and we keep on helping each other. And if there's something that we can share, and you know what? If you write to us and tell us, Uncle Charlie, it doesn't deal with COVID, but it deals with some kind of fundraising event to help those who have been affected by COVID. Let us know. We'll put the word out. We'll put the word out. Right, Mel?
Absolutely. In fact, we're going to be looking at something to do for the Christmas holidays, Charlie and I. We're going to use this platform to generate some kind of happiness for some kids. I don't know what it is yet, but we'll be doing something. But on that note, what I wanted to say, Charlie, because we get a lot of information from a lot of people, and I want to kind of make this disclaimer that today I had 3 different leads on behaviors that are dangerous, that are local people. And
Mm-hmm.
I'm just going to say it right now. Yesterday the lieutenant governor and myself had an exchange on text. I'm not going to
Ooh.
go into it, but I will say this. In my last text to him, I said, Josh, this isn't personal. I'm just trying to do my best to keep everybody safe. And I'm going to make that same message, or say that same message to everybody out there, that this is not personal. It's personal uh, as far as COVID is concerned. I'm taking this personal. And Charlie feels the same way. We take this virus personal. No one takes it more personal than Charlie, because he lost a brother. But we all in this canoe together, right? So don't take it personal. But when I get information from people in the community that are willing to step up and share something that's going on that is putting our people at risk, I promise you that I will make sure it gets investigated to the fullest and that prosecution occurs. And it may be somebody I know, it may be a friend, maybe a relative, but if you know me, that doesn't matter. It's never personal. But if you guys insist on going out there and doing things that are going to put others at risk and someone reports it, we will make sure that we take action. So today was disturbing. What
Yep.
I got. What I got was disturbing. Local people, don't blame no tourists. This is local people taking advantage of a situation. And that's all I'm going to say tonight because we're investigating. But I'm telling you, at the end of the day, when we're in court and I'm testifying against you, don't get mad. Don't get mad and don't take it personal because we're trying our best to stop this thing. And when I hear stories about our local people that are out there doing things that they shouldn't be doing things without practicing safety measures, again, taking advantage to make money off of from visitors in this time when they're not supposed to. Yeah, please understand. I don't care who you are. We're going to take it to the end. And I just wanted to make that point because I know we're going to get more reports. COVID fatigue is for real. People are tired of it and they're starting to get complacent and they're starting to do things they shouldn't do. So I'm not going to sit here every night and bash the tourists and bash the governor and bash the lieutenant governor when it's our own people making the mistakes and causing the risk. So I just wanted to get off that my chest because I forgot. I wanted to start off with that. I forgot. Just came back to me. But yeah, I mean, this is real. This is real. And I'm not going to sit back and let that kind of behavior go without doing something. Okay. Because just like you said, Charlie, you
Mhm.
go out, have fun tonight, and you come home and give that disease to somebody and they die. I don't like be the one that let something go that causes the disease to get taken to somebody's house and the kupuna die. I'm not going to sit back and let that happen.
I will share with you one thing, and this is, and I've mentioned this before. I've been very blessed to have had in my police career several other careers that I did it honorably, and I glad I did it. One of it was as a death investigator for the city and county of Honolulu. It's the setup is different there. So if anybody comes into the hospital and they die within 24 hours, that's a medical examiner's case. All cases are medical examiner's cases until such time the medical examiner can determine, or the investigator, that maybe the person who expired was under a medical care and it was destined that the individual would expire. So if the doctor is willing to sign off, then the body can be released to the family and they can make arrangements with a mortuary. The reason I'm saying this is because I used to be for several years when my wife was living here on Kauai, and I would fly from Honolulu to Kauai on my days off. I would sleep overnight at the morgue because I didn't want to drive all the way to Hawaii Kai and catch the first flight back. So I'll sleep at the morgue, and I used to always think to myself, wow, I made a lot of friends because why? And it's sad to say, but I was known as the Grim Reaper because on Oahu, I would be the one coming to your door and knocking on your door and letting you know when your loved one has passed away. I say this in all sincerity only because that's the kind of news when someone passes away from COVID, because you can't go to the hospital. You're going to get the call from the hospital, or you're going to get the call from someone like me that's going to tell you, I'm sorry to inform you that your loved one has passed away. Okay. That is what I am trying right now, really hard, is trying to prevent you from going through that experience. Because I have done it so many times. I have done it where a child was on a bike tour up Haleakala Highway. He had no business being with the rest of the group when he was coming down and the Roberts bus was going up and the Roberts bus ran him over. You know how hard it was for me to call the father in the mainland that his son was with the rest of the high school students and he got run over and he died? Come to find out, the father was a well-known surgeon and he was asking me every question because he wanted to know if we took all measures or if the hospital took all measures to try and save the son. Okay. I'm sharing these stories with you because there's going to be somebody like me that's going to come knocking on your door to let you know that someone passed away from COVID. And we don't need that. We don't need that if we just stay in our lane and if we just avoid doing the things we're not supposed to do, like large gatherings, or like thinking that you're so invincible that you can go hang out with your friends, drink up, let your inhibitions take over, no have one mask, and you're looking at them. And that's why I ask you the question. When you go out with your friends, do you know where they were in the last 24 hours? Because if the answer is no, then that is not your safety bubble. That safety bubble has been breached. If you can say, I know every minute for the past 24 hours where the person's been, then you get one pretty good chance you're going to be okay. But other than that, like they always say, hey, just assume the person is infected. We're over here telling the story. And I know from this COVID fatigue, sometimes you get a little bit upset. Oh, I'm tired of hearing Uncle Charlie. Oh, I'm tired of hearing Uncle Mel. What else you want us to tell you? That COVID is good? You want me to tell you that COVID is good? It's neat to have? Is that what you want me to tell you? And guess what? I'm not going to tell you that because I'm not stupid. And nor do I want you to get hurt, even if I don't know you. I love you I love you that much to know that even though I don't know you at all, I'm going to preach the word to you because this thing is dangerous. And there's going to be somebody like me, and you're going to call them the Green Reaper, that, oh boy, when Kanaka came over here and just told us that our mom passed away. And our mom passed away from COVID. How do you think you're going to handle that? I've seen it all. I've seen it all, you know? And the thing is this, sometimes the people, They'll ask you questions, and you might think it's so crazy and it's so foolish, but it's not because why? They're in pain. They'll ask you things like, did they suffer before they died? I don't know. Only God knows that. And you got to be very, very affectionate, and you got to be very, very to the point and be honest with them to say, I don't know. I wasn't there. Okay. Don't give anybody false hopes in anything, especially when the person dies. So what I'm trying to do is if I can prevent anybody from even getting to that point right now, I want to give the word while we all are alive. And let's just heed the warning so we can stay alive for many more years. We don't have to go before our time. Okay. If our life expectancy of 76, the only way you shorten that, if you decide to abuse your body, or you get stupid, or you get into an accident. But other than that, live out your life. Live out your life, gang. Okay. Now, this is Uncle Charlie talking. This is not the Grim Reaper. This is Uncle Charlie telling you there's a lot of good things to live for. Okay. You don't have to play with COVID, and you don't have to be like Evil Knievel. Think that every time you land broke bones, you're going to heal, because it doesn't always end up that way. You heard it from Sarah. Okay. You heard it from George Ma. Okay. You heard it from all of them. Russell Izumo. They'll tell you you're not the same, and you never recover. You always going to be recovering, because that's what they said. You're never the same. You're not like the original you once you catch COVID. Okay.
Yep. Well said, man. Well said. Yeah, I've never slept in a morgue. I don't plan to sleep in a morgue until I'm put in the morgue. Um, I can't imagine doing that. So that explains a lot right there, Charlie. That explains a lot.
Oh, you making fun of me?
But I can honestly say that there was more than enough times where I had to deliver that. That's the hardest part of being a cop, is to go tell someone that they love their child or their spouse, or that's the worst job. That is the worst thing to do in police work, is to go tell someone that their loved one has just passed away. And I kind of forgot about that, although it comes back every so often. But what you said about that one question, did they suffer? That was a common question.
Yep.
After everything settled down, and they just, officer, can I ask you one question? Did they suffer? And with COVID, I I don't think I think everybody suffers.
Hmm.
It's a horrific way to go. And man, I think about that, and I think, how do what, are you gonna lie to them?
Yeah.
I said, no, 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 they didn't suffer. I mean, a lot of the times with car accidents, you can, the person dies instantly, or but how do you tell the family? Oh, no, man, they was dying, they was gasping for their last breath, and people. I don't know how you get this point across, guys. We control our future. We control the destiny. We control our wherever you live. I don't care you live which island. We control what happens to our islands, and it's really so simple, that we just got to do it. Charlie, your analogy about that, going out for a night of fun in the bar, at a restaurant, having a few cocktails, or go to that beach pavilion to hang out with some classmates. Um, you saw what happened at the UH dorms. You see what happening in the college dorms throughout the country. I mean, people. I don't know. I mean, it's just, there's no more dispute as to how contagious this disease is. It is contagious. So let's do our part. Let's do our part, so no one has to go let someone know that their loved one has just passed away. Remember, COVID, you are alone, and the family is alone. You don't want to be on that receiving end of that message. So please, guys, let's refocus on what we can do individually
Yep.
to kick this virus's butt because listen, man, it's not gonna get any better for a while. So let's buckle down and let's do what we need to do. And the most important thing is share the word with everybody. Gosh, I sound like a preacher. Share the word with
Hallelujah.
man.
Hallelujah. Amen. I just wanted to say one thing. Raylene and everybody else, please don't be afraid of me. I had an office at the medical examiner's office. And yes, the refrigerators was right below me, but you got to go down one flight of stairs. Don't worry. I wasn't in there with my friends. I was in my office on my recliner because I reading this, oh, you slept in the morgue. I said, sorry. I should say I was in my office at the city morgue. Okay. That's where I slept. Just to get it straight.
That's one of the bad things about being a rookie. Yeah, you say, hey, Raposo, you go to the morgue. Why? Because you could go. And it's always fun to watch the new ones go in there. But a little bit laughter is okay. A little bit laughter is okay.
The kind of stuff I used to do. Oh my goodness! In the police department, we had a really good friend. His name was Tony Manukian, the late Tony Manukian.
Dr. Manukian.
Dr. Manukian. And my job was to break the recruits in so they don't get shell shocked and they go to a real scene and they faint in front of the family. So what they used to do is they used to let me jump on the table and cover me with the sheet and they bring the rookies in and they tell the rookies to stand around the table. They're going to perform an autopsy. And you can see because the big light they get over you, right? Once you see that, and that was my cue for sit up. I sit up, I go, argh! And oh boy, I got scolding from the chief of police. So never do that again.
I can hear your wife in the background. What?
I'm sorry. But that was years ago.
Charlie, tell them the story about Stephanie's like, no. Hey, one of you posted about that the people that should be hearing this are probably not on the show, and you're probably right. I think we're preaching to the choir, and that's why I talked about sharing. So guys, gals, you can share this video anytime. You can share this video. You can go down there, hit the share button, even when we're done, and it'll share on your wall. If you know someone that's a Facebook friend, you can actually send the link in Messenger. It goes up to YouTube. Send everybody to my YouTube channel. And folks, do me a favor tonight. Go to the YouTube channel and subscribe to my channel. Make me feel like somebody's watching. Subscribe button, hit the little bell button next to it so you get notified whenever we put up the new one. But send this video, make it go viral. That's what each of us can do. Make this video go viral. Listen, we don't get paid for views. We're not here to make money. We're just here to get the word out. So if you feel like others need to hear it, then share it. Just share it. And hopefully if everybody shares it tonight, or if everybody sends it to my YouTube channel, if we can get one person to connect and say, wow, you know what, I didn't think of it that way, then we made a difference, right? We made a difference. So anyway, Charles, it's 10 after 8, bro. That went way too fast.
I just like to send out one aloha to our good friend Jeannie Mendez Pfeiffer. She writes, I used to clean the morgue, LOL. I talked to them thinking they would talk back. I would doodle my pants.
How's Patricia Kramer? Patricia Kramer, my brother-in-law, Patrick Maderis, who happens to be my cousin, bless his soul, locked me in the embalming room at the Kauai mortuary. I thought I was going to doodle my pants. I like that. The common denominator, doodle my pants. Oh.
Thank you,
yeah,
guys.
That's not not a fun place to be. I mean, that's not a fun place to be, and it's not the dead that we should fear. Absolutely, Brenda, you're right. It's not. It's not. But yeah. Uh, I wonder if bro, you still get connections. I wonder if the morgue would let us do a Facebook Live from there.
Negative.
Patsy said negative.
Yeah.
No, we can. How's this? How's this? We set up a nice table with the wine glasses. We don't no wine, just water. We have the wives and us in the morgue, and we can do our show straight from there with the wives.
Go to the courthouse after work.
How's that? Is Steph okay with that?
No.
Auntie Steph, please. Oh my God.
Hey,
Oh.
it was nice knowing you guys. Pray for me.
Oh well.
It turned
Okay.
out to be a good night.
Yeah.
Good night.
That's why you don't like go off the air, because your wife will watch you with the frying pan.
No, I need witnesses. That's why I stayed on as long as I
know.
can. Oh man.
Oh gosh. Well, let's wrap it up, big boy. Let's wrap it up, man.
Okay, man. Okay. Thank you, everybody. Whew. That's not bad. Oh,
But every time you look back like that, I worry, because it's like I don't like witness the assault. I don't. So
No.
in my life, the only sound I get hard time describing is a sound of bang. That. When you take one flat frying pan and a bugger end up like on a walk. That's
yeah. Oh, Marlies Maliki says, I know I would puke. I see a body bag and I lost it.
Ooh.
Uh,
I'm sorry, man.
Cracks. Oh my God. Yeah, we're gonna get cracks. That night he told me, don't be scared of the dead, be scared of me, because I'm the last one that will put you down. Oh yeah.
Oh man.
That's the mortician. Oh my gosh.
Oh,
Whew, that's a good laugh. That's a good
yeah,
laugh.
it's a good laugh.
That was a good laugh. So what's your
My closing
comment
thoughts.
then, bro? Yes, please.
Yeah, my closing thoughts is my closing thoughts is gang, we gotta continue to be vigilant. And as was said last night, we know all the things that we need to do. Okay, social distancing, avoid large gatherings, face mask, and washing your hands. But you gotta remember that every time you take that mask on, put it off, take it off, put it off, put it on. Every time you have to break that routine and sanitize, because I'm still wondering, with all the precautions taken, individuals still got the virus. So that means that they had to have touched something and touched their face and get it in that way. That's the only way it could have been done. Okay. So all I'm saying is please be safe. We laugh now. When this whole pandemic is over, I want to laugh with you folks again. Thank you.
All of you.
Brother Mel?
All
Yep,
of you.
all of you. All of you.
We don't want to lose anybody,
Yep.
Let me just say this. We don't need a mandatory mask mandate, right? We just wear the mask everywhere we go. We don't need the governor to say, hey, you got to lock down. Oregon today, as I was listening to the governor, she said their rule is, as far as gatherings, you can only gather with one other household and no more than 6 people total. So like the governor said, she got to choose for Thanksgiving. So she's gonna, she's gonna have her daughter but only 6 people, and then they'll do a Zoom with everybody else. My point is this: we don't need the governor to say we're gonna lock everybody down, right? We're gonna lock every. No, we can do our. We don't need wait for him, right? We can limit our household parties or gatherings. We don't. We can hold off until this is safe. We don't need him to tell us. Everybody do that on their own. We'll be okay, right? So that's the message tonight. No wait for them because it ain't gonna happen. Let's start practicing it now as if it was the rule. Okay. Thank you all. Hey guys, I don't know. Tomorrow night we may not make it tomorrow night. We'll see what happens with the numbers. I was talking to Charlie earlier today. I said maybe we'll take the weekend off. I'm tired. Charlie's tired. You guys are tired, and I know. We'll see what happens tomorrow with numbers. What developments happen tomorrow. But we'll let you guys know one way or the other. Stay tuned to our Facebook pages. You'll see. It's just we're repeating ourselves, and we just kind of wait and see what develops, and then we'll make a decision. But anyway, you guys, thank you all for joining us tonight. Stay tuned to the page, see what happens tomorrow night, and we'll catch you guys on the next one. Hang on, let me put on. Aloha.